Hi, my name is Min. I will be refuting the argument of Gavin Munro that negative effects of stimulant medications outweigh the benefits. My opponent has discussed that ADHD medications such as Adderall hasn't been studied over a long period of time, loses effectiveness, has many bad side effects, and is prone to abuse. He also uses his personal experiences as facts to support the presence of negative side effects of stimulant drugs. For my refutation, I will discuss how my opponent is not utilizing information accurately and present studies that prove that stimulant medication benefits do outweigh the negatives of side effects. First, my opponent stated that the main side effects that are bothersome were things such as loss of appetite, headaches, loss of sleep, change in sex drive, vomiting, and restless leg syndrome. He also states that studies are relatively new and the single longest study was over a period of 14 months. The problem with this argument is the fact that conducting longer studies do not make a better study. This 14-month-long study only resulted with conclusions that ADHD medication dosages need to be increased over time. This fails to explore other studies that have been conducted in matters that concern issues that are far more important than the side effects of headaches and other symptoms previously said. Apart from helping focus, reducing crime, and decreasing impulsivity, stimulants have more medicinal benefits, and one of these significant benefits is preventing rapid cortical thinning. According to a cross-sectional study of other studies done on ADHD brains by doctors of pediatric psychiatry, almost all ADHD patients have an exclusive indication of decreased brain volume, otherwise known as cortical thinning. But what is cortical thinning? Cortical thinning is a decrease of gray matter in the cerebral cortex. Basically, the surface of your brain is decreasing in density. Cortical thinning does result in Lewy body dementia, Alzheimer's disease, and Parkinson's disease. Patients with Lewy body dementia are reported to be 3 times as likely to be an ADHD patient compared to non-ADHD, and 48% of Lewy body dementia patients had previous ADHD disorders. The same study suggests that ADHD could be initiated after the first step in these neurological disorders. Stimulant medication is proven to slow rapid cortical thinning in ADHD patients. According to a study done and published in 2008 by Shah Sharp, 24 of 43 adolescents were treated with stimulant medication, the others were not given medication. This resulted in a significant gap in cortical thinning over 4 years. The average rate of cortical thinning of adolescents without medication was 0.16 millimeters per year, while the medicated adolescents showed an average of 0.03 millimeters per year. This means that without medication, cortical thinning progresses at a rate of 5.3 times the rate of people taking medication. In regards to my opponent's personal experiences of side effects to represent the whole ADHD population, a quick sample from Jane Collingwood of Psych Central shows that 48% of 500 patients surveyed reported minuscule side effects of these medications, and 21% of that 48% reported the side effects to be very bothersome. These statistics show that a majority of people are not interrupted of daily activities from side effects. However, my opponent uses his personal experiences of side effects and unsupported studies to represent the whole population of ADHD patients. To say side effects make stimulants not worth taking. The fault in this claim is the attempt to overrepresent ADHD patients. Also, these side effects should be the last to worry about when it comes to more severe issues such as cortical thinning and dementia. Another problematic personal experience of my opponent was the fact that he stated loss of appetite leads to nutritional deficiencies, which leads to worse things. This is a non sequitur fallacy statement. A loss of appetite does not mean a person will have malnutrition. The result does not follow the cause, and my opponent is jumping to conclusions. Having a loss of appetite doesn't disable someone from eating at all. It just means that the person needs to carefully choose his or her meal under the limited will to eat to fulfill the daily recommended intakes of nutrients. To put it another way, appetite does not factor in taking multivitamin tablets or good choices of food. Lastly, my opponent argued that medication is sold illegally and misused by people that are not diagnosed with ADHD. The problem with this argument is that the availability of ADHD medication has no relation to the effectiveness of the drug. We have to argue in terms of how it is intended to be used. People who misuse the medications can't represent the effectiveness. On a side note, if people are misusing it, for example, to better their studying, it also indicates that the medication is effectively serving its purpose to instigate focus. But these are legal issues, not medication issues, and it should have been omitted when discussing the effects of the ADHD medication. It is clear that my opponent has failed to introduce more significant issues that stimulant medications cover beneficially. Also, his personal experiences cannot be a source to represent the whole population of ADHD patients. I hope you understand from these studies and statistics that the medicinal benefits of stimulant drugs outweigh the negative side effects. Thank you.
Better than mine. That's better than mine, man.
They're not even in the queue. That's not fair.
All right, you state the main and secondary issues clearly. You've got a good general explanation of what your approach to the argument is going to be, and I think that's fine. You signpost as you got to the first argument, and you raised some good questions about, for instance, whether or not the individual cases are enough to be making the generalization that's going on here, and whether or not other issues are more important. And I think that sets you up for your second 2 points. When you talk about the cortical thinning, I thought you did a good job kind of explaining what that is, how it's connected to ADHD, and then when you do the comparison, for instance, those people who are medicated versus those people who are not medicated, and you show that those who aren't medicated develop this cortical thinning 5 times faster than those who are medicated, that's a good justification for the medication that is being talked about. So it clearly has some effect here, and it's going to be beneficial in the long run for people to be medicated who face these sorts of issues. On the side effect arguments, I thought you had a good piece of information that says that's a relatively small number of people who show the side effects, and of those who do show the side effects, it's a relatively small number who find any of those side effects disabling, and you come back to the general criticism that the advocate's experience may not be typical, may not be adequate to be able to make a reference from. I think that there's you want to contrast the evidence that you're citing here. Is this a longitudinal study? Has it come from some authoritative medical group? How many people were observed? And contrast that to the basically the self-reported example that the advocate's presenting here, and show that your conclusion is supported by evidence that's vastly more likely to be accurate and effective there. The argument on the last point about it being non-sequential, I understand exactly what you're saying here. I think that is applicable. That's a reasonable challenge here. The fact that something gets abused doesn't tell us whether or not it is effective. It tells us simply that people are taking advantage of it for other purposes, but it doesn't deny that it is effective. You do almost make an argument there that says, look, the reason that they're using is to help them focus their studying. That sounds like somebody thinks it's effective in this particular case, but you say, I don't need to get into that because none of this matters, because the argument is really about whether or not it's effective, and whether or not people abuse it doesn't address that issue, and I thought you explained that very clearly. The main issue that I have for your presentation is it's all reading, and I don't think you look at us except for maybe 2 seconds in the speech.
Yeah.
You got to talk to the audience. You got to know what your argument is, and look at us. And I know that whenever people are trying to do this complicated type of analysis, they write it out and they want to say, I wrote it out, I've got it here, I understand it when it's looking at the page. But you have to understand the argument yourself, And the way that we can tell that you understand the argument is when you look at us and you simply, Gesundheit, you can simply say, on the question of whether or not it's being abused, the fact that somebody sells it to somebody else to take and get high on or to use for some other purpose, does that mean that it doesn't benefit the people for whom it's prescribed? No, it doesn't. Just look at us and tell us what the argument is. I know that you wrote out, you thought, I've got my analysis all written out here, but you have to understand it and just explain it to us. And that's the oral presentation issue that you got to work on. All right, thank you.